obviously healthcare has been on people's minds a lot, especially in the past 18 months. Is there a suggestion that applying the circular economy principles can also lead to better outcomes? And that could be, I say better for the patients, better for Philips in terms of profitability. What are some of the benefits?
Well, I think it potentially is a win-win-win. We work on something called the quadruple aim principle. So that's, to first of all, make sure that the patient is getting both a good experience, but also getting the right outcome for them. In order to do that, we also recognize that we've got to deliver the best possible staff experience. So give the staff the experience, the tools, the capabilities, the technology they need to deliver those outcomes to the patient. And in doing that, we also need to make sure that we're reducing the costs, so taking waste out of the system. And I think when you start to look at it at a system level, then that's where the opportunity to drive impact at scale really comes in.
Maybe we could move on to an example. So is there something that springs to mind of how circular design and this new approach or new way of thinking has actually led to new solutions for Philips in that healthcare realm?
Yeah, so I think also for a circular economy, circular design, we've really started to think about how do we also create social impact beyond just environmental impact, but social impact, which means we've also got to think about innovating in the world of business models, pursuing that dematerialization, stop the focus purely on the hardware and the product, think about digitalization as well, and then maximizing that lifetime value of products for the customer throughout the duration of the life of those products. So as an example, in Africa, fairly recently, we were partnering in Kenya with the Ministry of Health and some local clinical partners to bring portable ultrasound into the hands of midwives in primary care facilities in often remote locations. What these ultrasound devices would do, they're based on your cell phone. So they're using the cellular network, and they would provide both a combination of on-point obstetric screening to high-risk pregnancies. We would provide real-time video collaboration with more specialist caregivers who can be called up remotely. And we then supplement that with other cloud services. So for instance, artificial intelligence that would allow that midwife to spot problems and issues with that pregnancy at the bedside in that remote location. Now, as a concept that was developed around this African use case, but actually that's unlocked a new potential to take that ultra-mobile portable ultrasound into developed markets in Western Europe, North America, etc., where community midwives or general practitioners now have access to ultrasound on their cell phone.
And am I right in saying that conclusion, if you can call it that, wouldn't have been reached just by innovating in some of those markets you just mentioned, in Europe or in North America?
Yeah, it allowed us to reframe the problem. When you first look at the problem in the context, looking at it through, let's say, Western eyes, through developed market eyes, we would have naturally said, well, these midwives in Africa need access to ultrasound, but ultrasound's expensive. So could we cost reduce the existing product and make it appropriate, ruggedize it in some way for use in these locations? But when you're designing in context, on the ground, and co-creating with the people who are using this product, then it allows you to reframe the problem and design an innovative new solution because we were there unconstrained. So that allowed us to really think outside the box and come with this innovative new approach, which is now scaling globally outside of Africa.